If you have diabetes, you've undoubtedly heard of metformin, and if you're among the 92.6 million people who have been prescribed it, you know it very well. However, as any of those individuals will tell you, metformin may be marketed as the one medication to manage all of your diabetes, but it's not your brain solution. In fact, it's a band-aid solution that you may have been prescribed even though there's a good chance that your medication needs will increase in the future, either by increasing the dosage of metformin or by adding other medications to it. Are you interested in learning more? The most significant aspect of using metformin is that it diverts you from the carefully planned lifestyle change that is the true solution to both pre-diabetes and type 2 diabetes. This is because in this video, we will discuss the all-too-familiar path for people who are prescribed the medication to go on the medication train to nowhere. We will also discuss why the medication's actual effects can occasionally differ from its promises. Greetings, I have assisted hundreds of people in reversing pre-diabetes, type 2 diabetes, and gestational diabetes. The issue now is, are you prepared to be the next one? According to conservative estimates, 120 million people worldwide are currently taking metformin. Adding that, according to figures released in 2020, 90 million of those individuals reside in the US. What you're looking at is the amount of millions of metformin prescriptions written in the US between 2004 and 2020. The trend shows that the number of prescriptions for metformin more than doubled from 40 million to 92.6 million between 2004 and 2020. To put that amount in perspective, Google states that as of 2021, there were 331.9 million people living in the United States, which we may round up to 332 million. When 92.6 million prescriptions are split by 332 million people, about 28% of Americans are prescribed metformin. That is nearly 1 out of 3 individuals. Even if you want to round that number down to 25, 1 in 4 people have a prescription for metformin. Regardless of how you look at it, statistically speaking, you definitely know someone who takes metformin. In fact, you probably know between 10 and 50 people who are currently taking it because of its lack of hypoglycemic side effects. The next time you're at the grocery store, count the people you see that have a prescription for the medication. Metformin is frequently suggested as a first-line, safe, and affordable treatment for a variety of ailments, including but not restricted to gestational diabetes, polycystic ovarian syndrome, or PCOS, and prediabetes type 2 diabetes. Originally derived from French lilacs, metformin has been used as a blood glucose-lowering medication for nearly 60 years. Over time, it was successfully synthesized in a lab and is now widely used to lower blood glucose in people with type 2 diabetes. With multiple mechanisms of action that affect different tissues in different ways, metformin primarily interacts with your small intestine, liver, and muscle in your small intestine to reduce the rate at which glucose is absorbed into your blood. This helps you lower your blood glucose levels after a meal by lowering the net amount of glucose that enters your blood when you eat. Patients with type 2 diabetes frequently have elevated endogenous glucose production, or EGP. This is the liver's production of glucose, and lowering the rate at which it releases glucose into the blood is a very good way to avoid unintended blood glucose spikes. By lowering the pace at which your liver exports glucose into circulation, metformin effectively lowers the quantity of glucose that enters your bloodstream from your liver by lowering the EGP. Your liver produces less glucose to enter your blood. Metformin comes in both immediate-acting and time-release tablets, which can be prescribed depending on your specific needs. Metformin is typically prescribed in a smaller dose twice a day or in a single larger dose that can be taken with food. This lowers blood glucose levels in addition to the effects in your small intestine and muscles. Although the exact mechanism of action of metformin is not fully understood, scientists have noticed that its treatment activates an intracellular low-energy signal called AMPK, which is AMP kinase. Metformin is a commonly prescribed diabetes medication, the first line of defense for type 2 diabetes standard of care, and a medication that people desperately need to survive. Well, not so much, so buckle up. The typical starting dose of metformin is about 500 mg twice a day or 850 mg once a day taken with food. It is common for doctors to start at this dose and then increase by 500 mg per week over the course of a few weeks as necessary. The recommended maximum daily dose of metformin is approximately 2,500 mg per day. And now, let's go into great detail about everything you need to know about this specific pharmaceutical drug. Let's start at the beginning. Imagine that you were told you had type 2 diabetes, something you never thought would happen to you. You may be a little overweight, say you weigh between 10 and 50 pounds, and you know that losing weight can help you reverse the underlying cause of type 2 diabetes, which is insulin resistance, a topic we discuss a lot on this channel. You might occasionally indulge in a few cocktails, some delectable sweets, or a small amount of cheat food. You turn to your doctor because they are medical professionals and can help you understand what to do to keep things from getting worse because you don't fit the stereotype of type 2 diabetes that you've had for years and that you see other people with. It's shocking, confusing, and emotionally frightening. After ordering laboratory testing and measuring your fasting blood glucose and A1C level, your doctor uses their considerable medical experience and mental algorithm to conclude that you meet the criteria for type 2 diabetes. In the event that your A1C is higher than 6.5%, your fasting blood glucose is 126 mg per deciliter or higher, you take an oral glucose tolerance test and your 2-hour blood glucose is 200 mg per deciliter or higher, or you take a random finger stick blood glucose test at any time of day and the result is 200 mg per deciliter or more, your doctor is likely to diagnose you with type 2 diabetes. At that point, they run a sophisticated algorithm in their brain to identify any additional medical conditions you might have, such as in the United States. Common brand names for metformin include glucophage XR Gloptsa Fortimet or Roimet. However, most of the time, they don't give you any ideas or descriptive ways to reverse the underlying cause that causes type 2 diabetes in the first place, again known as insulin resistance, so you just start taking metformin blindly. Other symptoms include hypertension, high cholesterol, high triglycerides, evidence of arterial plaque, obesity, especially in your visceral or trunk area, elevated liver enzymes, damage to your kidneys, liver, kidneys, and more. You follow your doctor's advice because you're afraid that things might worsen if you don't, but after a few days or weeks, the side effects start to set in, including bloating, cramps, and abdominal pain. Diarrhea and nausea. Lactic acidosis, in particular, is uncommon in patients taking metformin and frequently occurs in patients with either a pre-existing medical condition that came before the use of metformin in non-diabetic patients. Other symptoms include general digestive discomfort or loss of appetite, as well as the development of a vitamin B12 deficiency or lactic acidosis, both of which can be a little more difficult to diagnose and take some time to develop. Lactic acidosis has a substantial correlation with heart failure in people with type 2 diabetes and is linked to infection, malignancy, liver failure, and renal failure. According to scientific data, respiratory failure, liver illness, and sepsis are the most frequent causes of lactic acidosis. However, enough about lactic acidosis. What matters most is that if you continue taking metformin and feel worse than you did when you were first diagnosed, but you are still confident that it is the best course of action going forward, you simply decide that you know what, I'm going to soldier on and just keep going. Or perhaps the GI issues actually worsen over time, and you may be prescribed a new batch of medication to address these side effects. This is only the beginning, as additional medication may be on the horizon. As a side point, we must discuss the 2020 metformin recall, which occurred because it was discovered that multiple prescription brands contained nitrosodimetholone, ANDMA, at levels greater than those typically permitted by the FDA. Apotex Court initially identified this contamination in metformin brands. Subsequently, 7 lots of the time-release were revealed to have NDMA contamination. Extended-release tablets of metformin hydrochloride manufactured by Amnio Pharmaceuticals. The FDA establishes the maximum amount of the contaminant that can be present in any drug and classifies NDMA as a possible human carcinogen, which is a cancer-causing agent. Amnio Pharmaceuticals voluntarily conducted the most recent recall to make sure that all lots fell below the FDA's permitted standards. Cross-contamination can arise during the production process since NDMA can also be introduced as a byproduct of the chemical used to generate a particular drug. NDMA contamination usually occurs when pharmaceuticals containing metformin are made in a laboratory setting. You may not be aware that metformin is not as safe as you may believe because, once more, if your doctor prescribes it and it's your first line of defense, what could go wrong? However, I want to concentrate on what happens even if you decide to take metformin and deal with some of these less than enjoyable side effects. For many of us, after 3 to 6 months of using metformin, you'll go back to the doctor and get another thorough blood test to measure your fasting blood glucose and your A1C once more. Now that you've followed your doctor's advice, you're feeling good about yourself. Since you follow your doctor's advice and take your health seriously, your fasting blood glucose is only 10 points lower than it was the last time it was checked. It went from 147 to 137, and your A1C decreased from 7.2 to 7.0%, which is a 0.2 decrease. These two numbers show that you're getting better, but you still have type 2 diabetes, and you've taken your medication exactly as directed by your doctor every single day of the week. After a few minutes of deliberation, your doctor decides that you should expect better results. He then says, "You know what? I'm going to have to increase your dose of metformin by 500 milligrams per day to get you up to 1,000 milligrams per day, or we're going to have to increase it to 1,500 milligrams per day, or maybe even 2,000 milligrams per day, because you know why that's going to have a stronger effect." You listen, thinking, there must be a method to this madness. And you continue to take the medication. But soon the side effects worsen and you start to feel trapped. But your doctor can't be wrong, can he? Pretty soon you realize that metformin is just a fancy band-aid. Your doctor isn't really helping you. They're just keeping your blood sugar from rising faster. Eventually, you're prescribed other blood sugar-lowering drugs, such as sulfonylureas, like glimepiride, glipizide, or gliburide, which stimulate beta cells to produce more insulin, which can cause low blood sugar and weight gain. Or perhaps you're prescribed something called a SGLT2 inhibitor, like Farxiga, Invokana, or Guardian-C. Do these names sound familiar? They can increase the amount of glucose you urinate into the toilet and have side effects. The question is, how do you get out of this? Because they are initially prescribed this prescription to address high blood glucose, but it may quickly spiral out of control and lead to them taking many medications that worsen the issue they were initially attempting to fix. The most irritating aspect of diabetes is that type 2 diabetes can be reversed. The science behind the disease can get quite complex very quickly, but if you want to discover the straightforward, tried and true approach to regain your life, you don't have to. Let's break it down. Most doctors are not required to study nutrition because it's simply not a board-certified specialty. They graduate from medical school without a thorough understanding of the true causes of the majority of metabolic conditions and the true root cause of insulin resistance, which is the central node to most chronic diseases. Insulin resistance influences almost every chronic disease you can think of, so in effect, doctors recommend what they recommend. As you can see on the screen here, insulin resistance is the central node that touches many different chronic diseases. And you can live a full and fulfilling life with type 1 diabetes. All types of diabetes, including type 1 1.5, pre-diabetes type 2, and gestational diabetes, are included in the upper right quadrant. Insulin distance also raises your chance of developing coronary artery disease and other cardiovascular diseases. Elevated cholesterol, atherosclerosis, and hypertension. Additionally, those who become more insulin resistant are at a higher risk of developing obesity, fatty liver disease, Alzheimer's disease, and numerous forms of cancer. Women with PCOS who are born with the condition develop insulin resistance and are frequently administered metformin and other drugs to control their blood sugar levels. Lastly, insulin resistance raises your likelihood of developing the inevitable consequences of diabetes, such as neuropathy, blindness, and kidney failure, in the upper left quadrant. This is where the massive lobbying of the healthcare and pharmaceutical industries comes into play. They are kind of always rubbing shoulders with doctors, suggesting specific types of drugs to prescribe, and doctors who don't know trust the institutional recommendations. Retinopathy and erectile dysfunction, despite doctors' claims that they are inevitable consequences of having diabetes, are actually consequences of eating a nutrient-poor diet and leading a poor lifestyle. And they simply prescribe a quick pill because that's what they were instructed to do. Now, a big part of this is that people, doctors, marketers, and salespeople are all searching for quick fixes, and they want to package this health information into a pill and give it to you because that requires the least amount of work. Most people want to believe that we live in a world where you can just take a pill and that's the solution, so we unconsciously want to believe that we can change lifestyle diseases, but we don't want to alter our lifestyle, which is where things can get messy. The end result is a flowchart like the one you see here. First, the doctor prescribes metformin, followed by lifestyle, but everything else is essentially about drugs. This is how doctors are taught to believe that changing your diet, incorporating intermittent fasting, and increasing your physical activity are never important. If they do, they may give you general advice like, oh, it's about diet and lifestyle. But that doesn't really mean anything because diet and lifestyle are massive universes and you have to get into specifics if you're going to promote any kind of real change. There is a lack of something known as actual food, as well as things like physical activity, intermittent fasting, mental transformation, and more. The most effective drug ever discovered by humans that has virtually no adverse effects is lifestyle modification. This isn't a pill, but it will save your life. It all depends on what you eat. The drawback is that you have to try it and that you have to work for it, but if you're prepared to do that, it will pay off 1,000-fold. The way you exercise and the choices you make about when to eat will need a huge change in your mindset. I know this can be overwhelming, but if you're ready to make a big change in your mindset by taking small steps over time, then you can let go of the notion that a quick pill will solve your problems. Instead, I want to give you the power to rely on yourself and not on anyone else. The most reliable and tested method is the Mastering Diabetes method. These 3 changes, a low-fat, plant-based, whole food diet, 30 minutes of daily exercise, and intermittent fasting, are based on hundreds of years of research that has been cited in over 800 scientific studies. We guarantee your success if you follow the method, which doesn't require you to take more medications. Quite the opposite, it lowers your medication use. If you're still dubious, listen to this. A landmark study to examine the effectiveness of metformin was published in the New England Journal of Medicine in 2002. Researchers randomly assigned 3,234 non-diabetic people with elevated fasting blood glucose to either a lifestyle modification program or 850 milligrams of metformin twice daily. The lifestyle modification group was instructed to exercise for at least 150 minutes a week, or roughly 5 days of 30 minutes of exercise per day, and lose 7% of their body weight. You can see how both the lifestyle change group and the metformin group affected fasting blood glucose. The lifestyle change group is shown in black, and the metformin group is shown in white. The researchers followed these participants for 2.8 years and found that lifestyle change reduced the incidence of type 2 diabetes by 58, whereas metformin reduced the incidence of type 2 diabetes by only 31. This means that after rigorous statistical analysis, the researchers found that lifestyle change is about twice as effective as metformin. Additionally, lifestyle change produced a measurable decrease in fasting blood glucose at 6 months compared with metformin, and that continued throughout the entire study. Furthermore, lifestyle change reduced A1C more than metformin at all time points except the 4-year time point. And teaches you one thing very clearly: less medication and more lifestyle change is better. Why doesn't anyone know this? The truth is that people do, and we're working hard to spread the word so that all 120 million people worldwide who are prescribed metformin as their first line of defense to lower their blood glucose will have the chance to understand that, while metformin can be helpful in some situations, it is not a long-term solution. Lifestyle change is simple, free, and accessible to you at all times. However, according to that 2002 article in the New England Journal of Medicine, using it as your "get out of diabetes now" strategy is deceptive and leads you down a dangerous path. It's only half as effective as changing your lifestyle, and it's a band-aid solution that frequently results in the need for more medication over time. It also comes pre-packaged with a number of unpleasant side effects. Changing your lifestyle is a tried and true method that will improve your short and long-term health and will work like wildfire to lower your fasting blood glucose, A1C, and body weight. Additionally, when you consider the advantages of eating a plant-based, whole food, low-fat diet, which will help you think more clearly, move your body more, lose weight permanently, and incorporate intermittent fasting, there's a reason we recommend this method to everyone, whether or not you have diabetes. Don't get caught up in the cycle, you're too smart for that. Take a moment, take a deep breath, and begin the process of changing your lifestyle today. I promise it will be the most powerful thing you ever do for yourself.